Welcome back, everyone. Is your skin starting to feel all dry and chapped, maybe a little bit itchy? It happens to a lot of people this time of year, but we have help on the way. Dr. Sherry Ingraham joins us live this morning from Advanced Dermatology to help us out with some great ideas. Good morning to you. I'm so glad you're here. What are your patients complaining about the most during these cooler temps?
You know, it's really interesting. This year we have not only the cooler temps, but we have COVID. So everyone is really washing their hands. People who didn't have hand eczema before now have it. So they're asking me, how do they prevent that from happening?
Okay, so what is something we can do to protect our skin? We've got the heaters on, we're drying all out.
So at home, what you can do, or keep in your car, in your purse, on your desk, especially if you're working from home, keep a barrier and slather it on throughout the day. CeraVe makes a petrolatum-based healing ointment. If you're starting to get those little fissures and cracks in your hand from overwashing, this is a great way to seal those cracks without having any irritation. If you have children, especially children who are tough to kind of sit down and put an ointment on, what I've found is Aquaphor healing ointment, which is similar. It's a really greasy ointment, but it comes in a spray. You can spray their feet and hands. You can even put cotton gloves on their feet and hands at night, or put them on yourself and let them go to sleep that way. And that'll prevent those cracks and those painful fissures. Also, if you tend to wash your hands a lot throughout the day, what you can do is keep a little CeraVe ointment. In the wintertime, we want to move towards an ointment and away from a lotion. Ointments are heavier, richer, more cholesterol, ceramide, thicker based products. And you want to put this on your hands as many times a day as you can stand. And really, I say before you go to bed at night, keep it on your bedside table and put a nice thick layer on.
Oh, you're making me want to go get some right now. Okay, let's talk about psoriasis, because I know a lot of people really start to have flare-ups this time of year. What do you suggest for a problem like that?
For something like that, if you are prone to psoriasis, studies have shown, interestingly, that if you can maintain the skin's integrity, if you can maintain the skin's barrier, your eczema and psoriasis will not flare as often. So if you want to sleep with a humidifier in your room, that will keep your skin barrier moist, especially as we have the heater on during these cooler temperatures. Also, washing with a ceramide-based cleanser like Cetaphil or CeraVe especially can help prevent the barrier from being disrupted. You want to avoid soapy cleansers. Those tend to wash off those evolutionarily designed protective barriers that are on our skin. And then for your psoriasis, if you're using medicine from a dermatologist, you want to alternate that steroid cream with a lipid-based barrier cream like CeraVe, or you can ask your dermatologist for one of these prescription barrier creams. You can use Episerum along your hairline if you tend to get psoriasis on your face and on your scalp and you're getting that flaking. You can put this on, it's absorbing instantly, and it'll help that scaling calm down and that inflammation and redness dissipate.
Now, we're talking about psoriasis, but what about another common condition like eczema?
Same for eczema, really. We tend to see more flare-ups of both of these conditions in the winter, but especially eczema. And I'm glad you brought that up, because all of this hand washing we're doing, if you're eczema prone, it tends to make your skin barrier go into the dry skin cycle every time we strip off the barrier with soap. So you want to reinstate that barrier. So you want to have a prescription for Episerum, or pick up some CeraVe at your drugstore and apply them several times a day. If you are someone who's using a lot of hand sanitizer at work, or again to prevent COVID, you want to focus on your palms. Use it on your palms, because what tends to happen is people put a lot on the tops of their hands and they overwash the tops of their hands, and that is where the eczema we see really flare up in individuals who are prone to hand eczema, is on the dorsum of the hand and over the knuckles. Again, getting some white cotton gloves. You can order them off of Amazon, or you can buy them at Walmart. Some white cotton gloves before bed. Put those on with a really heavy barrier cream under them, and that can help your eczema heal quicker.
Oh, such good advice. Thank you for that, Dr. Ingraham. Hopefully it'll help everybody feel better. Everybody I know is talking about it. It seems to be prevalent. So we'll take your suggestions. Have a beautiful day.
You too. Thanks a lot.